If you've experienced sciatica or are experiencing it right now, it's listed as the most painful MSK condition you can experience. We're going to go through the best approach you can use to manage it, including the top 3 exercises to do and what the options are if that's not working. And we're going to talk about one of the most important things to look out for when experiencing this, which will need immediate attention. Hi, my name's Rob from AMR Physio, and in this video we are talking about sciatica that's coming from the lower back, also known as radicular pain, where the sciatic nerve gets affected, causing pain into the leg. When it's down to the back affecting the sciatic nerve, it's normally due to a disc that's bulging or herniating and pressing on the nerve, or a narrowing of the foramen, the hole that the nerve comes out of, from either natural degeneration from aging or a bony spur. Sometimes it can be the slightest touch to the nerve or just general inflammation that irritates the nerve with no contact that can give sciatic symptoms. Normally with sciatica, you definitely want to get checked out by a health professional. The first approach is a non-invasive one, including exercises. However, instances to look out for where this may not be the case is if you have illness and fever associated. If you have loss of control of the part of the leg, this may represent a more severe compression to the nerve. An example of this would be a foot drop where you're unable to lift your foot up. Another thing to be aware of is if you've ever had cancer in the past. A common place for metastasis is the spine, so it's getting checked to ensure a tumour isn't causing the nerve compression. But one of the most important things to look out for is a loss of control or sensation around the genitals or back passage. This is known as Cauda Equina Syndrome and needs immediate medical attention. So don't delay getting seen with any of these, as some may require an immediate surgical intervention. If you don't have any of those and you're looking for the best exercises, we have the top 3 you can do for sciatica. Number 1 is knee rolls. So laying on your back for this, knees bent with knees and ankles together, then rolling the knees from one side and then to the other. You'll probably find you can move better in one direction than the other. That's normal. Just go to the range you can get on either side. What you don't want here is to be increasing any leg pain or pins and needles, as that would be a sign it may be irritating the nerve. So go less into the range on the direction that causes that. The idea behind this is that it's almost winding the disc back in. Similarly, this is where walking can be beneficial for this. As you're walking forward, one leg is going forward and then the other, which is rotating the pelvis one way and then the other. And this is normally better with discs. And typically with discs, it's where sitting is more painful than standing. Whereas a lot of the time when it's foraminal narrowing, sitting is better and standing and walking can sometimes be worse. So with any of these, it's really about how you respond and what suits you best. Number 2 is the cobra. This is where you'll lay on your front and push yourself up with your arms while keeping your pelvis towards the ground. You can go at different levels with this depending on the pain. You'll be better starting more shallow and then building the level up over time. The idea behind this is almost like you're trying to push the disc back in the other way, away from the nerve. However, again, if more due to foraminal narrowing, this is likely really going to aggravate symptoms, so always judge it on your response. Sometimes it can even be suggested that going into extension can make a disc bulge worse, and flexion can make it better. This is where the idea of going into a preferred direction comes from, promoted by McKenzie. There are tests of repeated movements you can do to check this, but generally, if you find sitting is worse and standing is better, you'll likely do better into extension and with this exercise. But if sitting is better and standing is worse, you'll likely be better into flexion and will likely not get on with this exercise. Number 3 is a nerve glide. This is where we are wanting to actually give a slight stretch to the nerve, like we would a muscle. The sciatic nerve is travelling from the back down the leg into the foot. We can add a stretch by bringing the leg up straight and the toes up. Go on and off with the stretch by moving the ankle back and forth, so it's a glide or a floss on and off. You can also glide this at the other end. So before leaving the spine, it comes from the spinal cord, which is traveling from the brain. So by flexing the neck down, it adds tension at the other end. So now you can glide through the whole system, and rather than tensioning at both ends, that might be irritating, add tension one end and then the other. So toes up and head up, and then toes down and head down. The majority of people will improve with symptoms taking the non-invasive approach. But even doing it this way, it will still take several months of being consistent and will likely be extremely painful for parts of that journey. And it can be a pretty dark time for people. So it's also important to make sure you're getting psychological support if needed. We know that keeping moving with this is important, and generally bed rest isn't beneficial. But it's still important to modify activities so you're not aggravating the nerve, such as not sitting for a long period if that's aggravating for you. If you're not getting anywhere months down the line and pain is still ongoing, that's where a nerve root block may be considered. That's a steroid injection around the nerve root. This comes with slightly higher risk as you're going more invasive, and it's to help the leg pain mainly. A lot of the time the back pain comes from muscle spasm as it tries to protect the area, and is where the injection is less likely to help with. The final stage is surgical, so a discectomy where they remove a part of the disc that may be affecting, or a laminectomy where they remove some of the bone if that's the issue. This carries a lot more risk as you're going much more invasive. Sometimes this is necessary to prevent further issues such as with Cauda Equina. However, there is no guarantee with this that it will get rid of the pain. I really hope this was useful for you. For further guidance on how to progress rehab, watch this video here, where we go through reps, sets, and how to work on modifications most effectively.